every decision is made for the safety of you and your baby, but not made without you. That's what I want you to know. It has to be made with your consent. And the only way you can make informed choice and decision is to also. Hello and welcome once again aboard JulieCity. How are you keeping? I hope you are keeping well and safe. As usual, I'm always excited to be here, and I'm glad you are here. Thank you so much for clicking in to join today's video. You're highly appreciated. If you have been my subscriber, I want to say I am sorry for disappearing. Just 2023 brought a lot of drama, but it's behind us. And if this is your first time, hand on heart, as much as it is possible within my capacity, I will try to be as consistent as possible. Thank you so much. Now, I did promise that I was going to do a series on midwifery, pregnancy and maternity. And basically, I want to focus on some of those issues that arise during pregnancies that as pregnant women, or those who know those who are pregnant, that we need to become aware of health issues that arise during pregnancy, and knowing when to do your research, ask questions, and ensure that your pregnancy goes hitch-free. This series is not to scare anyone, but it's based on the knowledge that we all agree on JulieCity, that knowledge is power and our health is our wealth. If you believe in that, then we need to get knowledge and understanding so that for any reason such issues arises in pregnancies that we are involved in or know someone who is involved in, we're able to act effectively to avoid stories that touch. So there'll be a few of those videos I'll be doing. I'll keep it as short and sweet as possible. And today I am going to be looking at hypertension. One of the things that causes an eyebrow to rouse in maternity care is hypertension in pregnancy. Now, there are two types of hypertension in pregnancy. The first one is chronic hypertension, and the other one is gestational hypertension, and I would distinguish between both. Now, chronic hypertension is the hypertension that already exists before pregnancy occurred, or already exists before the 20 weeks gestation of pregnancy. And most people would already have been on a particular medication before pregnancy and all of that. It's always important to plan pregnancies. I know sometimes it happens unplanned. It's not to judge. It's just if you plan things like this, especially with pre-existing conditions like hypertension and diabetes, it's easy for your healthcare professional to put things in order to make sure that the pregnancy goes hitch-free and seamless as possible. Now, the other hypertension, which is referred to as gestational hypertension, is that hypertension that starts to stir its face when a woman is 20 weeks pregnant and above, begin to experience raised blood pressure. When women begin to go for the antenatal, they begin to experience a blood pressure that is higher than 140 systolic and higher than 90 up to 100 diastolic. That's when the midwife or the obstetrician begins to worry or show concern and want to put a plan in place to ensure that this is effectively managed to avoid stories that touch. Now, when a woman becomes pregnant, as early as possible, it is important to register with a midwife, a trained midwife, or a doctor, depending on what country you are operating from. By doing so, the woman's pregnancy and the woman herself is monitored effectively to pick up some of these issues that would cause complications or cause special circumstances to arise, and nip it in the bud to ensure that mom and baby are safe. So, one of the things as a midwife we do in antenatal care, which is a care during pregnancy, is check your blood pressure and do a urine dipstick. And that urine dipstick basically tells us what is happening inside. That urine can, first of all, at a glance, can show us if you're well hydrated, if you're drinking fluids, as in water, tea, milk, enough. And then you hear your midwife say to you, you need to drink a little bit because your urine is a bit yellow or concentrated. And the other important thing that we check in that urine dipstick is to see if there's any protein in the urine. So when there's a trace of protein in the urine, that begins to tell something. And if that is combined with a raised blood pressure, then that is beginning to say that the blood pressure is beginning to take another turn, getting into an area that we don't want it to. And it is important, if you're told by your healthcare professional that your urine has protein, please ask questions, do your research, and see what that entails, even in a situation where you're not giving a lot of information. Because there might be a trace of protein, but your healthcare professional or your midwife or doctor will reassure you accordingly. But when it begins to rise into plus, 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 and all of that, then it's something to look into. Like I said, when it is combined with high blood pressure, that means that it is moving from just hypertension to a more complicated situation, which is what is known as pre-eclampsia, and you don't want to go to pre-eclampsia. Protein in the urine, which means that the kidneys are beginning to struggle with keeping up with everything that is going on, and so they are not able to filter effectively. Therefore, protein begins to seep into the urine or into the system, and that is what we want to nip in the bud. So what do? You ask questions with the information that the healthcare professional, the midwife or the doctor will give to you. It's important that you also go out and make your research so that you can ask questions. And that is one reason why I am sharing this video, bringing out basic information that will help you to begin to think and ask questions and wonder, like cause you to, oh, that's a red flag. So what next? Because everyone is different, and the plans that we put in place will be specific to suit you and your present condition plus your baby. Sometimes you might find face swollen, hands swollen, feet swollen. Like I said, that's because the kidney is beginning to struggle with the amount of fluid in the system. Coupled with the protein in the urine, it is not really spelling well. It is not for you to just chillax. Yes, don't panic, but make your research, ask the correct question, and trust your healthcare professional with the information you have to look after you. Work out a plan that will suit you and keep you from harm's way. Now, preeclampsia can also make progress to the worst case scenario, which is what we don't want at all, and that is eclampsia. That's where the woman begins to have seizures. Blood pressure is over the roof, protein is on the high, swollen hands, swollen face, depending on individual. All might not come in one person, but you have all of these signs, vision disturbances, and then seizures. Of course, in pregnancy, that is a no-no, and that can be very fatal. That can be really deadly. So we don't want to get to that point. That is why it's important at the early stage that first, you attend antenatal regularly. Second, you ask for your blood pressure to be checked if your healthcare professional is forgetting, and dip your urine to tell you what is your urine. Ask questions, don't just keep quiet. If they take your urine sample, ask when they come back, what is the result? If they say there's a trace of it, what do I do? They will give you health talk, pep talk to help you manage the situation, or they will give you an appointment that will mean that you might have to go see the doctor. That is if it is the midwife you're seeing, for further review and further plans that will help to keep you and your baby safe. It also could mean that they might put you on a particular medication. Like I said, it's different from every individual, and so it will be looked at case by case. So please ask questions. When your urine comes back, ask. If they say there's nothing, hallelujah, that's what we all want. We don't want anything in that urine. But if they say there's a trace, what can I do to make sure it doesn't exceed the trace? They will put a plan in place. If they say there's a plus or plus plus, don't just walk away. Ask what can be done. Like I said, it's not for you to panic. It's for you to be prepared. For you, with the knowledge your healthcare professional have, your midwife or your doctor has, be able to look at what your specific circumstances are and make a plan that will keep you and your baby safe. Things come up, and again, that's why we are here, to make sure that when those things arise, that they are looked into effectively, and with your consent, things are put together to keep you and your baby safe. So yes, for one thing you will take out of this video today, there are two types of high blood pressure in pregnancy. One is the chronic high blood pressure, which is the one that starts either before pregnancy or during pregnancy before 20 weeks. Then we have the gestational hypertension, which is the one that starts from 20 weeks. This is brought on as a result of the pressure the body is going through by being pregnant and housing the baby. So the plan that is put together is meant to keep you and your baby safe. And at every antenatal appointment, this will be looked at, updated, and highlighted in order to make sure that things are still working as desired. Sometimes, like I said, it's different for everybody. Sometimes it might be necessary to deliver the baby in order for the mommy and the baby to be safe. If that situation arises, like I said, it's not to scare you, it's not to raise false alarm, it's not to drain your faith. No, have your faith, but knowledge is power. When you know what your prayer point is going to be about. Then if you're well informed, you know exactly what to do. It won't be making you feel like a failure. No, that your baby, you didn't carry it to term, or that you have to birth your baby because you have arranged for home birth, or you are so determined to have a vaginal birth and now it has to be cesarean section. You owe nobody anything. When you are alive, then that is the most important thing. What you owe yourself is making sure that will safeguard you and safeguard your baby when you are pregnant. So if that has to be the way to go, then so be it. You'll be empowered enough to make the right decision for you. Don't just depend on them say, they said, that person used to have it, it was dreadful. No. Don't do that to yourself. Just go to the relevant website that you've been given to by your healthcare professional. Make your research in the appropriate way, the right websites and the right books. Read so that you'll be well informed, so that you will not base that very life important decision on assumption. Rather, as an informed choice, you'll be able to do what is right for you and your baby on an informed basis. The most effective way to manage an escalating hypertension in pregnancy, when it begins to threaten the life of mom and baby, is to deliver baby. That way the body gets rid of that which, as much as our baby is important to us, but our body is unable to cope with the pressure of housing baby and will need to be born, so that the appropriate medications will be given to the woman to bring her blood pressure safely down. Why it is important, apart from the fact that our body is not coping, is that some of the medication might not be suitable for the baby in the womb. So it's best to separate mommy and baby, effectively manage mommy's condition. On the other hand, high blood pressure in pregnancy comes with a lot of complications, not just for the mommy, but as well for the baby. Sometimes as a result of the high blood pressure, baby is unable to get the adequate nutrients that it needs through the placenta. Therefore, growth is restricted. So you have babies that are actually dangerously not gaining weight in the utero, that is inside the womb. So the safest thing for them will be for the doctors to deliver them early in order to feed them, that they might survive and thrive effectively. So that's why sometimes you hear doctors will say we need to deliver, not because any of the doctors or any of the healthcare professional is wishing you bad. No, every decision is made for the safety of you and your baby, but not made without you. That's what I want you to know. It has to be made with your consent, and the only way you can make informed choice and decision is to also make your own research, and that's the essence of this video. So yeah, I'm not going to be very specific in the management because, like I said, it's based individual by individual, but medications can be used, lifestyle can be advised, and ultimately if it becomes dangerous, then baby might need to be born a bit early, or induction of labor. It might be inducing the labor to get baby out fast so that mommy can be treated and baby will not be in harm's way. I hope you found this video useful. If you've had, please give me a like, subscribe if you have not, leave a comment for me in the comment section, and share this video. Till I see you in my next video, don't forget, your health is your wealth. Bye. Don't forget to click on these videos popping. You might find them interesting. Watch them and share. Leave your comment, like I said.